We want to invite into this stream the founder and CEO of the company Covac Global. Ross Thompson founded this company, and they're doing something. There are lots of companies out there that if you happen to be traveling and something goes wrong and you're in a global hotspot, they evacuate you. This company does that if you've got COVID. So tell us more about this and where you're seeing, I know you can't reveal some of your clients, but where you're seeing growth. And I just know from my experience with network news that the networks have hired companies like this for years when they send people into war zones to help evacuate them when necessary. Is that kind of what you're doing?
Yeah, so we have decades of experience with crisis response and evacuating people and rescue. And actually, when the pandemic hit, we ran a global company that responded to kidnap and ransom events. And so we had offices in Florida, Mexico City, London. And when the pandemic hit, we realized that if I travel or one of my guys travel around the world and we get COVID and we get sick, then are we, beholden to a local hospital, Medicare system, healthcare system, quarantine? And so we actually looked for an off-the-shelf solution, and none of it existed. So what we did is we took our expertise in crisis response and getting people home in really bad situations. And we took our relationship with the London insurance market and we came up with Covac Global. And it's been going strong ever since.
Have you seen a rise just in terms of the number of people that are trying to use this because of the numbers that we're seeing from the Delta variant over the last couple of weeks?
Sure. So this year alone, we've had thousands upon thousands of new members. You're absolutely right. There's been a big spike in the past couple of months with the Delta variant coming out and really throwing us for a loop. We thought there was a recovery coming, but now it looks like the pandemic is going to be here to stay. Reuters came out with an article today saying the Delta variant could be the most contagious, infectious virus in history. CNBC said the pandemic is far from over. So we're really focusing on the pandemic. Our in-house medical teams are really focused on the variants, how they're evolving, how they're affecting our members, travelers. Obviously, we're seeing vaccinated people overseas testing positive and getting sick.
How do you protect your staff that might use a private aircraft to go pick someone up who's got COVID and bring them back to the United States? And what kind of regulatory protocols do you have to follow once you get here?
Sure. So all of our medical transports are done via air medical transport, so air ambulances. So converted Learjets or Falcons or Hawkers. We even use helicopters. We've even had to use speedboats to get our members from overwater villas in the Maldives to airports where they can meet our air ambulances and our crews. All of our flights are done not only with our expert pilots, but there's critical care paramedics, there's doctors on board. It's all overseen by our global physicians. And so the transport itself is very complex. For instance, we did a transport from Ethiopia back to Washington, D.C. the other week. And not only did we have to coordinate with the Ethiopian authorities, but we had to coordinate with the Egyptians and the Sudanese for overflight permits. So again, it takes a lot. This still is a contagious disease, landing, refueling our complex, and then obviously working closely with the CDC, State Department, Department of Homeland Security, Customs and Border Protection. Those are all key. Our staff comes from a myriad of backgrounds, including federal law enforcement, the intelligence community, military special operations. Again, we have a full in-house medical team. The medical director is actually a former colonel. So again, it takes relationships, it takes expertise, and we have a team that just does that flawlessly. For the hard stuff, we do weekly evacs from Bahamas back to New York, Chicago. Again, great relationship there with the Ministry of Health and Tourism there in the Bahamas. So again, relationships, expertise are critical to this business, and naturally, it's something that we work hard at every day.
Ross, who is this available to, and how much does it cost?
So it's available to everybody. So all nationalities, residents of all countries can become members of Covac Global. The 15-day COVID-19 repatriation membership starts at $675 for a 15-day trip. We have a 30-day trip. We have an annual membership for $2,400. And that covers you if you get COVID overseas or if you get COVID more than 300 miles from your home. So we will do everything it takes up to $1 million to bring you home. And so that's the COVID membership. But we also have a traditional medical membership. We've taken the successes and the lessons we've learned from our COVID membership, which does not require hospitalization, I might add. So every other company in the world requires hospitalization. We do not. So we took that methodology and that way of doing things into the traditional medical as well. Whereas if you have a car accident, heart attack, slip and fall overseas, we want to get you home to your own doctors and your own hospitals as soon as possible. We have a security membership that will step in if there's any personal security emergency you're experiencing, war, terrorism, natural disaster. We see the wildfires in Greece right now. People are getting evacuated. We saw that in South Africa with the civil unrest, the riots, where we had members on safari that were being affected by that, and we'll get them home for that as well.
$675 seems like an incredible bargain for people who want to avoid any kind of risk. We appreciate your being here and wish you all of the best. Ross Thompson, Covac Global Founder and CEO.